about this.
Dr. Adil Haider of Aga Khan Hospital.
So tall, you can see him all the time. Noroz reminded me that it's Iqbal Day. So he said, "Aapko sher pad dijega." Now remember, I grew up in Indiana. Wasn't a lot of Iqbal going on over there. So then I said, okay, aap bachcha ko sher WhatsApp kar rahe. Okay, is it okay if I kind of do English Urdu like this? Okay. All right.
Exciting.
All right. So the share he said was, I'm usko padhunga na kal galt खुद ही को कर बुलंद इतना, खुद ही को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से पूछे बता तेरी रजा क्या है। Now I didn't really understand. I can explain. So what I did is I did what most people will do when they can't understand Urdu, and I'm sure many of you can relate to this, and maybe you have been on the receiving end of that phone call. I called my father. So he explained that the idea is to raise yourself to such heights. Raise yourself to such heights that luck will be on your side, and God may actually ask you what you want.
Dr. Adil Haider, Aga Khan Hospital.
So we live ourselves so that Iqbal is like saying you need to really raise yourself up. But then my dad, who by the way loves Chicago and had his first job in Chicago and sort of grew up in Chicago, my uncles have lived in Chicago. He said, you have to be careful when you talk about this. Because if you're going to be talking to people of Pakistani origin, many people left Pakistan and came to America because they realized that even if you were able to do what Iqbal said, which is to raise yourself up, perhaps, he raises this question, and I don't agree with everything he says, but perhaps the playing field is not even, and so even if you raise yourself up, you may not be able to achieve what you achieved. And that, in fact, at the same time that Iqbal was talking about this share in the 1930s, in 1931 was the book, The Epic of America, was published, in which they talked about the American dream. Right? The idea that no matter who you are, no matter where you come from, with hard work, khud hi ko buland kar de, right? With hard work, you can achieve anything. And so he said, be careful if you're going to use that share when you talk to Pakistani diaspora. So all the facts and figures have been given by the CEO, but since I'm a professor, I'm going to lay this proposal to you. To ask the question, is there a place in Pakistan where if you listen to Iqbal and if you do hard work, you can achieve anything? And I'll give you 3 stories, and I'll let you make up your mind if APU is one of those places. The first story is of Zubaydah Siraj. Zubaydah was born in the northern areas. She grew up over there. Many of you know that Aga Khan Education Services has many schools in the northern areas, right? She went to one of those schools. She was outstanding, superstar student. She was one of the students who were admitted to the Aga Khan University's medical college program. The MBBS program that Shahid and I both are very fortunate graduates of, this year, there were 6,000 applications for 100 spots. Shahid mentioned my previous job where I used to work in Boston. Trust me, they don't have 6,000 applications for their 140 spots. The most competitive medical college, one of the most competitive medical colleges, where she did a fantastic job, and then she wanted to be an eye doctor. So she trained in ophthalmology at the Aga Khan University Hospital. So as we said, there's a medical college, a highly competitive medical college. By the way, the medical college, somebody was asking me this, so I'll just make sure you know. The medical college is #1 in Pakistan. It's in the top 100 in the world, and #1 in Asia. residency programs, after you finish medical school, you do residency, she got into residency programs. We have 35 different residency programs, 35 different ones. Think about it, and we have it. And we even have 37 fellowship programs. So what does that mean, right? I mean, you want to go into medicine or surgery, go residency with you. And then you want to subspecialize, vascular surgery, breast surgery, electrophysiology, the heart. That's a fellowship. We have 37 of those. So she did her residency in ophthalmology. Then she actually got a fellowship to do subspecialty in Ireland. She went to Ireland. She did her subspecialty training. She even wrote a book about how to train ophthalmologists, which won multiple awards. And then she's like, I'm going to come back.